Hi everyone, welcome back to my YouTube channel. Today we are going to talk about periodontitis. So let's start the topic with introduction. Periodontitis is chronic inflammatory disease affecting the supporting structures of the teeth, including gingiva, periodontal ligament, alveolar bone, and cementum. It is caused primarily by bacterial infection and can lead to tooth loss if untreated. Now let's talk about definition of periodontitis. Periodontitis is an advanced stage of periodontal disease characterized by destruction of periodontal tissues due to bacterial plaque accumulation. It results in gingival inflammation, pocket formation, and bone resorption, ultimately leading to tooth mobility and loss. The disease typically progresses from gingivitis, that is a reversible form of gum inflammation, to more severe irreversible condition. Now let's talk about key features of periodontitis. Key features of periodontitis include deep periodontal pockets, gingival recessions, loss of attachment of gingiva, alveolar bone resorption is there, and tooth mobility is also the characteristic feature of periodontitis. Now let's talk about causes and risk factors of periodontitis. Periodontitis develops due to bacterial colonization and immune response. Several factors contribute to its onset and progression that may include microbial factors, and microbial factors may include plaque accumulation, that is dental plaque is the primary cause of periodontal disease. There may be microbial factors depend on bacterial virulence or the virulence of infecting organism, as pathogenic bacteria such as Porphyromonas gingivalis and Agribacter actinomycetocomitis disrupt the normal oral microbiome. And there may be host factors that may cause the periodontitis, that may include immune response, as excessive inflammatory response can lead to tissue destruction, and genetics, as some individuals are genetically predisposed to periodontitis. Further talking about causes and risk factors, there may be systemic conditions that may assist in periodontitis, and these include diabetes mellitus, that is high blood sugar level affect wound healing and increase susceptibility of periodontitis. Second systemic condition may be cardiovascular disease, as inflammation in the gum can contribute to the heart disease. And hormonal changes, that as pregnancy and menopause can influence periodontal health. And the next risk factor includes lifestyle factors that may include smoking, as it reduces blood flow to the gums, affecting healing. And the poor oral hygiene, as insufficient brushing and flossing lead to the plaque build-up, and stress that weakens the immune system and increases susceptibility to infection. So this was all about causes and risk factor of periodontitis. Now let's talk about pathogenesis of periodontitis. Periodontitis develops through a sequence of pathological changes that include plaque formation, that is, bacteria colonize the gum line and form the biofilm. Next stage is gingival inflammation, as bacterial toxins triggers immune response leading to redness and swelling in gingiva. Next stage is periodontal pocket development, as junction epithelium migrates apically, creating deeper pockets. Next stage is bone resorption, as osteoclast decays alveolar bone, reducing bone or tooth support. Next phase is tooth mobility, that is progressive destruction leading to loosened tooth, and at the end there is tooth loss, that is because of without treatment, or and it can lead to advanced periodontitis that results in loss of dentition. Now let's talk about clinical manifestation of periodontitis. Symptoms of periodontitis vary depending on the severity of the condition. It includes gum bleeding, that is common during brushing or flossing. It also includes red or swollen gum that are signs of inflammation. It includes gingival recession, that is because of exposure of tooth roots. It may include halitosis, that is bad breath, and that may be due to bacterial presence. It may include pain or discomfort, that is sensitivity in affected area, pus discharge, that is indicative of infection, and tooth mobility, that is in advanced cases leading to loosening or shifting of the teeth. Now let's talk about diagnosis of periodontitis. Periodontal disease or periodontitis is diagnosed through clinical examination and imaging techniques. Clinical examination include probing depth measurement, as periodontal probe assess pocket depths, and attachment loss evolution, that is determine tissue destruction, and bleeding on probing, that indicates inflammatory severity. So these are the clinical examination that we do that may indicate periodontitis. And then there is radiographic analysis for periodontitis that may include X-rays to detect alveolar bone loss, CT scan to provide detailed imaging in advanced cases, and then we can also do microbiological and genetic tests that may include flock sampling that identifies specific pathogens and genetic markers that assess predisposition to periodontitis. Early diagnosis is crucial to prevent irreversible damage in periodontitis. Now let's talk about classification of periodontitis. Periodontitis is categorized based on severity and progression, and the classification of it includes chronic periodontitis that is common in adult and is slowly progress with inflammation and attachment loss. Second class of periodontitis is aggressive periodontitis that is rapid bone destruction, and it is because of strong genetic influence. And the third class is necrotizing periodontal disease that is characterized by necrosis of gingival tissue and bone, and it is associated with immunosuppression or malnutrition. Next type is periodontitis as a manifestation of systemic disease that may be linked to diabetes, cardiovascular conditions, or immunodeficiency. Now let's talk about treatment and management of periodontitis. Effective management of periodontitis involves non-surgical and surgical approaches. Non-surgical approaches include scaling and root planing that remove plaque and calculus, antimicrobial therapy that is use of antibiotics and antiseptic mouth rinses, laser therapy that reduces bacterial load and inflammation, and then we have surgical treatments that include flap surgery that involves lifting the gum for deeper cleaning, bone growth that is restoring lost alveolar bone, and gingival growth that treat recessions and improve aesthetics. Then also there is lifestyle modification in the treatment of periodontitis, as it include maintaining good oral hygiene through brushing and flossing, and quitting smoking to improve periodontal healing, and healthy diet that is rich in vitamin to support gum health. Now let's talk about prevention of periodontal diseases or periodontitis. It can be prevented through consistent oral care, that is brushing twice daily with fluoride toothpaste, regular dental checkup for early detection, flossing to remove interdental plaque, using antimicrobial mouthwash to reduce bacterial load, and balanced diet to support immune function. Preventive measures significantly reduce the risk of periodontitis. Now let's talk about conclusion of this lecture video. Periodontitis is a severe oral health condition that affects the periodontal tissue and can lead to tooth loss if untreated. It is primarily caused by bacterial plaque accumulation, immune response dysfunction, and lifestyle factors such as smoking and poor oral hygiene. Early detection, proper management, and preventive strategies are essential to maintaining oral health and preventing complications. Advances in periodontal treatment, including regenerative therapies, continue to enhance outcome for patients with periodontitis. And this was all about periodontitis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.